Hello and namaskar. Today we are going to do a comparative study of materia medica, and this is another way to study materia medica, which is as important as studying a remedy in depth. Okay, so when we study any remedy in depth, what we do is we try to understand the pathophysiology of the remedy, the sphere of action, and the type of indications it produces, the kind of action it has, and all the peculiarities of that remedy as well as the common clinical conditions in which it is used. And by doing so, we study the remedy in depth and we know the remedy as a friend of ours or as the back of our hands, right? But when we do that, we obviously come to the understanding of a single remedy. But comparative study is also as important as studying a remedy in depth, because when practically we are in our clinic, we understand that a patient has come to us with a specific clinical condition, right? And then we have studied many remedies in depth, and we know that for a certain kind of clinical condition there are these many remedies available to us. For example, if you take simple acidity or dyspepsia, we know the wide range of remedies that are available to us for the same disease, okay, or same clinical condition. Like we'll think of nux vomica, we'll think of asafoetida, we'll think of iris versicolor, okay, we'll think of many such remedies with that we commonly know of for the same clinical condition. So will though all those remedies will come to our mind, but then differentiating those remedies, comparing between them and giving the one which is really indicated for that patient will be our skill. And for that skill, comparing the remedies is also as important as studying each remedy in depth, and hence we are also going to do that kind of study over here in our video lectures. And we're going to study each clinical condition that we can, like, as much as we can cover, and we're going to compare remedies for it, and that's how we're going to go about it. So today we are going to talk about the comparison between remedies or for the clinical condition sprains. Okay, it is a kind of injury and it is easy. So let's start with sprain, and we're going to study it from this beautiful book, Comparative Materia Medica by Dr. E. A. Farrington. It's an amazing book, and it has many kind of differentiations for of remedies for different clinical conditions. Like here it is for sprain that we're going to study today, then it is there for syphilis also, for rheumatism, right? So many such conditions have been given. So today we're going to talk about sprains. So for that, first we'll understand the clinical condition sprain. We'll start from the basics, although many and all of you must be knowing about it. Let's just revise our basics. So if we see that there is a stretching or there is a tearing, right, of any ligament in our body, then that is called as a sprain. And if the stretching or tearing of muscle or tendon, okay, then it is called as strain. And these words can be used interchangeably also, but there is this minute or difference in between them, right? So what is a ligament and what is a tendon? So we already know that, but as we've decided to just go over the basics as well, let's also discuss that. So, ligament is basically the one that actually connects a bone to another bone, right? For example, here we have this knee joint, and this knee joint we see that this is femur and this is fibula, and the ligament that joins it is called as lateral collateral ligament. So, something of fibrous tissue actually basically which joins two bones together is a ligament. And when we talk about tendons, we see that when we have a bone and a muscle, so this is a muscle and a bone, and this band of tissue which is joining the bone and the muscle is called a tendon. So the one that joins muscle and bone together is called as the tendon. Now, when we study this book and we see what Dr. Farrington has written about under the clinical condition or injury sprain, we see first of all he mentions the remedies that are indicated for a sprain, which are ammonium carb, ammonium mur, arnica, Calcarea austrium means calcarea carb, petroleum lustox, ruta, strontium, and sulfuric acid. So there are many remedies which we might not have known for this condition, and he has also mentioned the indications for the same. So let's start with the first that he mentions is ammonium carb. Okay, and we do not at all think of ammonium carb for injury. As we learn about injuries in college days. So, but when we study books like these, we come to know about the indications of such remedies for such conditions as well. So in ammonium carb, the injured joint is hot and painful. So if there is a sprain around any joint, for example, very common joint that gets sprained or ligament around a joint that gets sprained is the ankle joint, right? So for example, if the ankle joint is sprained, the joint must be hot and very painful for ammonium carb to be prescribed for the same. Okay, then what does he talk about ammonium moor? He says that it is indicated for chronic sprains. So, for a patient who has been having a sprain which has been painful for a long time and it is not healed, you can think of ammonium moor, and the symptoms here are relieved by continued motion. So, if in case we did not know this, we feel shocked about it. But many authors write about it. So, for example, we can just refer this book that is the Sign or Synoptic Key of the Materia Medica by Dr. Boger, C.M. Boger, and he also under this remedy ammonium moor writes that it is indicated for sprains, and in bracket he also writes that it is chronic. So it is a well-known remedy for chronic sprains, that means, right? And he writes better by rapid motion, and over here we've seen that Dr. Farrington also mentions that it is relieved by continued motion. And we see here that Dr. Boger writes that there is also this sore sprain or cold between scapula. So we see that kind of sphere of action of this remedy present here, and we have pain in our ulcer unhealed. So I know that this remedy, and you might also know that this remedy is a very good remedy for calcaneal spur. So pain healed for the same. Right, so this remedy kind of has an action on those areas, on sprains which are chronic. Okay, so for chronic sprains, think of ammonium moor first before any other remedy right now, right? Like from now. And next we see that he compares ammonium carb again with sulfuric acid. So another injury remedy which is not very commonly known for college students. So ammonium carb is again he says see above. So injured joint is hot and painful, and sulfuric acid has long lasting cases with soreness and stiffness. Again, a patient who has had sprain and that has been there for a long time, again like chronic sprains like ammonium mood with soreness and stiffness. So there is stiffness, so movement is restricted in sulfuric acid. And now if we see sulfuric acid from the book by Dr. N.M. Chaudhary, we find that he writes that it is one of our great remedies for trauma. We use it to remove the bad effects of mechanical injuries such as falls, blows, bruises, etc. Frequently, we notice extravasations of blood from the effect of such injuries. So, again, this is a very great injury remedy. So, what we need to remember about sulfuric acid is that it has long lasting cases with soreness and stiffness. So, there is stiffness in the joint as well, along with soreness, that is pain in chronic cases. Stiffness meaning what? That movement is not that easy, movement is restricted, and in ammonium moor we see that symptoms are relieved by continued motion. So that's it. Then he talks about arnica versus ammonium carb. Again, ammonium carb. So in arnica, he says that it is considerable if there is considerable inflammation of the soft parts rather than the ligaments. So, for example, you have this ankle sprain. Okay, somebody's ankle joint gets sprained, the ankles gets sprained, and then you find that the ligament is obviously sprained, but there is a lot of inflammation of the parts, soft parts of the in tissues around the ankle. So there's a lot of edema and a lot of inflammation. Okay, there's a lot of inflammation. Then you can think of arnica. And ammonium carb, it follows arnica. So if the injured joint is hot and painful, you might first give arnica, because arnica is a trauma injury we all know, right? So the first remedy that very naturally comes to our mind whenever we see any kind of injury is arnica. So if you find a patient coming to you with a lot of inflammation of the joint and there is pain, you might give arnica first. And the injured joint, you find it to be hot, you find it to be painful, and after arnica has done some of its work, you can give ammonium carb because it follows arnica. Okay, then we see that he again compares Rustox with Arnica. So Arnica we have already studied, and what Rustox does is that it reduces the inflammation of the tendons of muscles. So now, Arnica's action that Dr. Farrington writes about was on the ligaments, right? But here, when he's talking about Rustox, he's telling us about the inflammation of the tendons of the muscles. The patient has relief of his symptoms by continued motion while he experiences aggravation on beginning to move. So, this is a very peculiar characteristic and well known sphere of action that we find to be present in Rustox. So, if we have this kind of peculiar picture, we can give Rustox again. Now he talks about calcareous carb as well in comparison to Rustox. So if you give arnica, and after arnica you will have to give ammonium carb. It is not necessary, but that kind of situation might arise that you have to give ammonium carb after arnica. In the same way, here under calcareous carb he writes that it follows Rustox when that remedy has relieved but fails to cure. So you might not ever think about it, but it is so. After giving Rustox to your patient who has Rustox like modalities, who has Rustox like symptoms, and Rustox does help the patient but does not completely take the pain away, does not completely help in the recovery of the ligament or the tendon and the whole area that is affected, then you have to give calcareous carb. Okay, so calcareous carb follows Rustox when that remedy has relieved but it fails to cure. Next, moving to strontiana carb, we see that it is again a remedy for chronic sprains, particularly of the ankle joints. So this is very particularly of the ankle joints, okay? And ligament injury can be anywhere, tendinitis can be anywhere, tendinitis can be in your knee also. So anywhere there can be tendinitis, anywhere there can be sprains, but especially when it is of the ankle joint, then you have to think of strontiana carb with some edema from long interference with the circulation. So you do not only find the like if even if the sprain has like been there for a long time, that it is it is chronic, still there is edema. Okay, so edema in the joint for a long time with because of sprain in the ankle. So the remedy will be strontiana carb. Now here he write that arnica precedes strontiana. So you're first given arnica, right? Because when the patient came to you, the first remedy you thought of was arnica. So you gave arnica, but arnica has helped maybe, but it is not helping a lot, and maybe you do not have the injured joint to be hot, to be painful, for it to be followed by ammonium carb, or you have missed the whole stage of ammonium carb, and now the patient is having this sprain for a long time. It has become chronic. Okay, and now the edema has also been there for a long time. So now you can think of strontium carb. Okay, and strontium carb also follows when ruta fails to cure. So like you can give it after arnica, you can give it after ruta. So you gave arnica and it did not help, you gave ruta and it did not help much, or it helped, it relieved for a certain extent, and then it has stopped acting. You can then use strontium carb for sprains. And when we talk about ruta, it precedes strontiana and it is worse in the morning before rising. So the patient will tell you that I have this sprain and it pains, vagara, etc., etc. But it is worse in the morning before rising. Okay, that is what your patient will tell you. So when you have such a kind of a condition, you see that these remedies are indicated. What did we learn? We finally learned that the first remedy that you will think of in such cases of sprains will be arnica, can be ruta, can be rustox. Okay, the first remedies, okay, that should come to your mind when you see a kind of in a sprain. Okay, arnica, rustox, and ruta. But when it has gone to the next stage, okay, after arnica, after rustox, after ruta, right? So let's write this down and understand it. So the patient has been given arnica as the first remedy when he came to you, or maybe he has been given rustox as the first remedy, or maybe he has even given ruta as the first remedy. If he has been given arnica, then the next stage might come of ammonium carb, right? Of ammonium carb, because ammonium carb is has this kind of injured joint, it's not nipple, and it follows arnica. That is what we've understood. And then if the patient has come to you with the inflammation of tendon, and if he has this peculiar modality of rustox, of amelioration by continued motion but aggravation by first motion, then you're given Rustox, and the next remedy that might follow after Rustox will be Calcarea carb, because Calcarea carb has been used when, or has to be used when Rustox has been given, but it has relieved and not cured. Fine. And when you have given Ruta, and Ruta has also helped some but does not completely cure, then you can give strontium carb, right? And strontium carb can also be given after arnica, right? Strontium carb. So this is the whole thing, and so these are the remedies which are used for chronic sprains. Okay, chronic. Strontium carb is for chronic sprain. Ammonium mur also, we've not written about it. So two more remedies that we studied for chronic sprains were, along with strontium carb, we studied ammonium mur and sulfuric acid for chronic sprains. Okay, so this is what we learned today. First, if you're giving arnica, it can be followed by with ammonium carb or strontium carb, Rustox, then Calcarea carb, Ruta, then strontium carb, and for chronic sprains, strontium carb, ammonium mur, sulfuric acid. So that is how we can manage patients of sprains, right? So this is how we learn when we study comparative materia medica, and we remember better, we can help our patients better with this. And we've already done one video on comparative materia medica, which was done from ML Tyler's materia medica, and I'll just also add the link to it after the video, after this video. Thank you, that's all for today, and I hope you like this comparative study also.